Hey, last week we got a call, you might remember, on the open line from a listener named Kate. She was telling me about an amazing mental health support group. They're called Being. Now, we did a bit of research and found some more information out. And let me tell you, what this group does is quite outstanding. They're an independent organisation. They speak to those in tough situations, people with mental health issues or those who are in emotional distress. But what makes Being even more special is who it's run by. It's run by or staffed by people who've gone through these issues themselves. They have a hotline called Being Supported, almost 7 days a week it's open. They can relate, give you help to those who need it most. And I did want to get some further information, as I promised our listener Kate, on Being. Irene Gallagher is the CEO of Being Mental Health and is on the line. G'day, Irene.
Oh, hi, Luke. Thanks for taking the time to chat with me today.
Not at all. Thank you for being available, and you come highly recommended by one of our listeners. Can you tell us, though I mentioned a bit there, a little bit of the background of the group Being and, what you do?
Yeah, sure, absolutely. So Being Mental Health Consumers is the New South Wales peak organisation representing people living with mental health issues and emotional distress. And we have a long-standing history of 26 years of operation and in advocating our community's rights to diversity, respect, inclusion and equity. So our primary focus is to ensure the experiences and the perspectives of people living with mental health issues are heard by decision makers and service providers and the community. So you could say that we aim to lead and influence systems reform within mental health services.
And you obviously assist those people in some way, those people who are suffering. So this hotline, tell me about it.
Yeah, absolutely. So as part of the $73 million that was allocated by the New South Wales government to support mental health wellness during COVID, our organisation was funded to pilot a 6-month program, quite a unique program, going through to roughly about mid-February, and that was called Being Supported. And probably a little bit of information is that Being Supported we call it a warm line, and I can talk about that a little bit more in a minute, but it's a non-crisis support line that is run by people living with mental health issues.
Yep.
And our workers have experienced their own challenges. They've had challenging times themselves, either related to mental health issues, suicidal thoughts or crises. And the warm line supports and promotes recovery, empowerment, hope and healing to people who need our support.
Now, using people who've had a journey themselves, is this new? Is this revolutionary? Is this copying something that worked elsewhere? Is it a new approach that we're pioneering now? Tell me about that, where it came from.
Well, I suppose our organisation, we call ourselves a consumer-run organisation. That is that all of our staff live with mental health issues, emotional distress and suicidal thoughts. But being supported, I guess it's really powerful to have people who have had their own challenges supporting others. Our slogan is, we've been there, we get it. So our trained and... Yeah.
That's fantastic. That? We've been there, we get it.
We've been there, we get it.
Oh, fantastic. That's fantastic.
So our trained and skilled peer support specialist staff, as I said, have all faced their own adversities. To be able to sit with someone and communicate with someone and talk to someone about those adversities, to share snippets of our own journeys and quite specifically how we found hope amongst those adversities is incredibly powerful. And I suppose for our callers to speak with someone who's come through the other side,
yes,
this can be inspiring to so many and really instill a sense of hope that tomorrow is another day.
Well, and living proof that there is another side, and you can, if you're able to navigate that. How do you find people? I mean, the obvious answer is someone who's had a bit of a journey, but how do you specifically recruit people who can have this affliction or have this affect them and then be able to deal with others who have it to help them make a successful trip through it, if that's the right expression? That must be a real skill
Yeah, it is, and I mentioned beforehand that our staff are quite skilled and they're trained as well, and they do have the skills to support people, not just through times of adversity and loneliness. We're a non-crisis service, but of course, if we do have people who are in crisis, we're able to refer them and direct them to appropriate services. But it is certainly a skill. I mean, we talk about our own lived and living experiences being an expertise in its own right, to be able to support people in such a way that we're bringing that expertise forward. But also, I suppose, working with people so that they can also recognise that expertise within themselves, that incredible value that they have, not just to organisations like us, in working with organisations like us, but also with the people that they support.
Indeed. Time has got us, Irene. How do I direct people to find out more about the organisation? Yeah,
so our website is www.beingsupported.org.au. And our phone lines are open from 10 a.m. to 4 p.m. and then again 6 p.m. to 10 p.m. 7 days a week. So I'd certainly encourage your callers to ring us if they do require some support.
Brilliant. Irene, thank you so much.
Oh, thanks so much, Luke.
It's a pleasure. Yeah, you too. Irene Gallagher, the CEO of Being Mental Health. If you miss those details, give us a call here and we'll help you out. News comes up in 11.